Well, Chance IT there bringing that to us. And it's all about the effect of coronavirus on our lives. And indeed, we told you about the conversation we wanted to. We wanted to have a conversation for which we wanted to get into the heart of many varied experienced professionals. So, 100 days of COVID right here in Ghana, based on the measures we've taken. We initially started with the announcement during the restrictions, banning of flights, lockdowns, then removing the restrictions ultimately, but well, just making sure that we return life to normal, but what we are calling the new normal. Now, we need to get the professional observations from personal to professional experiences, etc. So we're aggregating some of the best people we have in Ghana, professionals, experienced people in Ghana on this platform. So you'll see them on Zoom very soon. I have Professor Mponsa Tewia, who the University of Ghana Business School is professor of human resource, and so knows what he's going to talk about. And then we also have the most Reverend Dr. Paul Boafo, who also is chair for the Christian Council of Ghana, and all of them are here. And ultimately, we have Professor Yorson as well. And then we have Sefam Lord-Mensah as well, who also is an educationist. Okay. Sefam, please adjust your camera very well. Perhaps let's go back a bit. Yeah, and then get to your left a little. Your left a little. Yeah, yeah, very good, very good. Zoom is good. Coronavirus has taught us a lot of things, right?
That's one of the lessons.
Yeah. All right, can I get everybody? Professor Tewia, can you hear me?
Yes, please.
Great. Sefam, can you hear me? No, unmute your sound, Sefam. Unmute your sound.
I'm good.
Great.
Okay, I can hear you.
Fantastic.
Can you hear me now?
Yes. As for Dr. Paul Boafo, I can gladly hear.
Yes, I can hear you.
Yeah, the most Reverend Dr. Paul Boafo is a regular on the show, helping us do great discussion within this period. And then also we do have Professor Yorson. Professor Alfred Yorson is a virologist and disease control expert. So we have a human resource professor, expert, consultant. I know that Professor Yorson, Professor Mponsa Tewia likes a lot of money, so does a lot of consulting. When he was teaching me at the business school, was always talking about his experiences outside, so it helps as well. But look, let me start with the clinicians. It helps so that we put all matters into perspective. I start with you, Professor Yorson. Now, 100 days of this right here in Ghana. Can you give me your observations based on what we've learnt from the field that you practice, from the time that we made the announcement up to today?
Great. We got to know about the pandemic way back in late aspect of 2019, and then we got our 2 new cases in March. That was quite an initial stage, and it was scary for everybody. We didn't know how the pandemic was going to evolve. Looking at what was happening in Europe, in the United States, and other areas. So we, as a nation, took some bold initial steps in trying to contain the pandemic. A lot of the initial cases were from travelers who came in, and so we had to trace their contacts aggressively. And it has evolved. Our numbers have increased quite, I would say, hugely. And now we are having over 14,000 infections. And we are gradually beginning to see a shift in the pandemic. We are getting to see relatively more symptomatic cases. We have seen almost 92% of our infections being asymptomatic. But now the infection is quite well settled, as I'll say, in the community, and therefore people are coming to the health facilities, especially with symptoms. And then when they get tested, they turn out to be positive. So that is the stage of the pandemic we are in now, firmly established in our communities. You never know who is carrying the virus. And that is why it is so important that we continue all the measures we have put in place, especially regarding the measures at the population level, social distancing, wearing of face masks, as well as the need to strengthen the health facilities, especially the protection of health workers, because that is where we are heading to now. We are going to see more persons who are infected reporting to the health facilities, and that's where we need to strengthen the fight from.
And you, Reverend, what have been the observations you've made since it started that have impacted the field that you practice?
Yeah, thank you very much. The church has been very much impacted since we had our first cases. That was when the church had to also join the lockdown. The churches were closed, chapels were closed, and we had to resort to online services, resorting to social media to reach our people. Apart from that, we also saw the level of vulnerability in our society, in the church, where we had to also come in to help people out of the pandemic, because they were virtually taken out of jobs, and so there was no money, so the church had to come in to help people. Apart from that, we have also been the source of hope and allayed people's fears with our prayers and all that. And this, I think, has very much impacted the mega churches, the smaller churches, the rural church, the urban church. Everyone has been affected. Ministers of the gospel, congregants now cannot meet together to worship, and so get the gospel by social media. And that has more or less taken a toll on the church. And it's been awesome. It's been awesome. Yeah.
And for you, the two of you who are in education, Cepham Lord-Mensah, and then Professor Amposa Tavia. But because Professor Tavia practices not only lecturing but also consulting, let me seek your view. We know that it's impacted your field a lot.
Yeah, thank you very much. I think that, well, when it comes to the field in which I find myself in, particularly in education, well, you reckon that, well, here in Ghana, the online teaching, online learning wasn't something that we're used to. But currently, now it is something that, well, we are all enjoying. And with this experience, you reckon that, well, most institutions are putting themselves in readiness. And I can tell you that, well, yes, post-COVID, the online teaching, online learning is going to become the new normal. Most institutions now have spent a lot of resources putting in place the infrastructure to support this online teaching and online learning, and students are also getting themselves into it. To be frank with you, especially with our executive students, you reckon that, well, most of them now prefer even the online teaching and online learning because they are able to really connect via the comfort of their homes. I mean, from the comfort of their homes, and they are much more relaxed. And now we see much more engagement on the part of students because, well, now they are not in a hurry to come for the lectures and they are not looking at closing early. They are in the comfort of their homes, they're connecting, and the lectures are going on so well. In the field of practice, when it comes to consultancy, you reckon that, well, now also you don't have the face-to-face contact in as much as, well, most of the organizations organize webinar sessions to help in training their staff. You also reckon that, well, now organizations are resorting to online training platforms, and that is also working as well. I think what is much more important is that, well, organizations are coming to the point of realization that, well, now the Ghanaian can work from home. In the past, the thought was much more the case that, well, the Ghanaian is quite lazy. So, well, if you introduce the telecommuting or the flexi system of work, Ghanaians will lazy about in the house, not necessarily working and come back to complain. But ever since we entered into this era, you reckon that, well, most individuals are working from home and they are even much more productive. Something that we've been talking about in the past, because in Ghana, especially within the capitals, you reckon that the traffic situation alone get people a bit worried even before getting to work. But they wake up quite early, they drive through the traffic, and they're even worried. And that in itself affects their productivity and performance. But now in the comfort of their homes, having set up workstations from their homes and working remotely, they are achieving their target and even much more exceeding from the records that we have. And it is working. So I think that, well, moving forward, this is going to become the new normal, where now you are not going to have organizations residing necessarily in architectural edifice, but then you could have people also working remotely. Because when we talk about organization, in actual fact, it is not the architectural edifice, the building that makes the organization. It is the individuals coming together, connecting, that makes the organization. So now we are going to have a lot of networked organization post-COVID, and that is going to become the new normal. And then this will call for businesses having to position themselves to learn how to manage their employees remotely.
Yeah.
Well, this is where I will leave it for now and come in later.
Sefam, if you look at all the stages of education that have been affected, it also means that parents have learned something. Your interactions so far, what have been your observations you can pick from the time it started and where we are, knowing that schools gradually are being eased into the new life of normalcy?
Okay, so I would target my submission from the parental view as well as the secondary to basic education. You realize that from the 15th to this time, schools are out. We've been called in to come back again, but then it's not the normal means of doing things. I've also realized that COVID-19 will not be the last, it's not the first and it will not be the last virus that would shake the foundation of our family existence, the way we socialize, the way we go about things. From that time up to now, you notice that the inequality gap in education, there's a spotlight that has been cast on that inequality gap. So yes, for the tertiary level, they are making good use of the online or the e-learning platform. However, with the secondary and then the basic, it's not everybody that has been able to migrate or is taking advantage of this online or distancing education. So it's really affecting most of the people around. So yes, it is good, but then the content to even deliver the items is also becoming a challenge. For example, it wasn't something that has been planned. It just happened. Yes, we need to migrate from our traditional way of delivering education to the modern way where we need technology or where we have to blend everything together. We have to blend the skills, we have to blend technology, and we have to blend the content. And so this is becoming a challenge. You know, we are working at it, but I'm hoping that as time goes on, everything will be okay. We will come to, it will be our new normal. But hey, it's really affecting everyone out there.
Now, Professor Yosin, there's a great debate, and it just started over the last 24 to, if not about 36 hours, about the way now we have decided, based on the advice of you, the professional clinicians, the government team, the Ghana Health Service, that we're going to adopt wholesale what the WHO says should be by way of the discharges. It's got everybody concerned. Even the three of the other guests, I'm sure, are also concerned. How do you think we've performed by way of assuaging people's feelings and the psychology of the population? in terms of disease control and the things that need to be done?
Yes, one of the challenges we've had through the fight against COVID-19 has been the communication strategies we've been using, as well as data and information management. We will all agree there have been some challenges and some grave misspeakings along the way, and these have not contributed very well to the fight and boost the confidence of people. However, I must say the effect on health workers have been grave, and we need to continually support them, and also all the persons in the front line of fighting this. That is the initial thought I want to put across. With the new policy, you mentioned that we are adopting the WHO policy wholesale. It is not. We have also done our own local research, albeit much more to be done, to indicate, as it has happened in other jurisdictions, that after a certain period, the individual who is infected might not, that's why we say it's unlikely. In medicine, in public health, there are no absolutes. So we cannot say it's 100% absolute that each one of them will not be able to transmit. But on the broader scale of things, we say such an individual who is asymptomatic after 14 days is unlikely to transmit the virus. You may even test positive on the PCR, the test that we are doing, but it doesn't necessarily mean a positive test at that stage, at that late stage in the disease, means the person is symptomatic. So we shouldn't be overly worried. Other instruction in there is that even when such a person is discharged from isolation or from home management, it is still instructive to know that such persons are to remain for about a week without engaging in social interactions and others. So that gives us close to 21 days, which is what we used to do. So it is all for people to comply and to be able to support this cause. But I don't think, by way of science and by the current knowledge that is available, although COVID-19 is dynamic and evidence keeps changing, for what we have, I think we can go along with what has been prescribed and the data we have and we have looked at. There are other research that we can do to support the evidence going forward. And I think we should, as a nation, commit resources and effort in doing that so that we can be bold and then come out and say that, yes, in fact, the decision we've taken is the right one. But current evidence and all that we have support that we can discharge these patients, encourage them to stay about a week longer in relative isolation. We won't say complete, but limit the social interaction, by which time we know certainly they are unlikely to transmit the infection.
Asafo Paul, is that not where, ideally, knowing that we had the congregation in the hands of the church, perhaps when it came to the psychosocial aspects of the way we needed to comfort, spread calm, communicate well about this, rather we should have been working closely with institutions like you, the educationists and the human resource experts to make sure that we permeated the mindset of the population?
Yeah, that's very true, because the church stands for the welfare of the individual in all regards. And so people felt that, look, as they listened to their pastors, as they listened for the word of God and the assurances and hope that was coming in, these were places where you could come in to have the fears allayed, the fears taken away from the people. And that is what the church has played all this while. From the very beginning, even before the whole thing started, we were praying and giving assurances that, look, the Lord is with us, and if we go through the protocols as laid down, we know that we are conquerors and we shall overcome this pandemic. And so, for what is coming again to us about the way people are coming out of it, we as a church, we believe that if we come in to support, if we come in to help in giving the information to people that this is the way to go about it, the whole thing can go down well with our rural folk, especially because they know that the pastor, as he comes in to speak, as the church leader comes in to give any information, that is the truth. That is the truth. And they believe that, yes, is the truth that the pastor or the church leader is giving. And I believe that the churches must not be relegated or put aside, but must be made part and parcel of any solution, of any policy that comes into the system, because we play a major role in bringing healing to our people.
But Professor Amponsah, if we don't communicate well, then everybody becomes afraid. The employer at the end of the day, and even the workers also tend to feel this trepidation or anxiety. In the workplace, how have we fared with the way we should have ideally been communicating and managing?
Okay. Thank you very much, Roland. I can imagine that one. And from what I said, I think that the irony of the whole situation has to do much more with the fact that at one point, you reckon that the corporate responsibility in terms of giving out to society is quite huge. But on the other hand, the stigmatization is also increasing. And that, for me, is the irony of the situation. People are giving out. You see, when we went on the lockdown, look at the institutions that went given out. But now people recover, and now getting them even accepted at the workplace is becoming a challenge. And that is a major issue we need to also address. But I can imagine that especially in the formal system, what is actually happening is that yes, institutions have adopted various mechanisms, various ways of communicating, because they have their own platforms that they use, the intranet, they have their own communication mechanism that they use in communicating to their members. It so happened that it is the informal sector that the challenge is. And that is why I would tend to agree with the Reverend to say that, there was this lapse in involving community leaders, because you reckon that, in our environment that we live in, the community leaders play a key role in enforcing rules and regulations of society. And I dare say that when you go out there, some people indeed fear community rules coming from community leaders, even more than that coming from the government. I can imagine when the chiefs within the Ghana region impose a ban on drumming, you reckon that people adhere to it religiously. But in the same vein, they are asking people to put on their nose masks, and it's a challenge coming from government. So I can imagine that, yes, the communication should have been such that, it employed all the tools, using community leaders, using educational leaders, using religious leaders. And I can imagine that in the country where we have the Ministry of Chieftaincy and Religion, I would have expected that they would have been involved in communicating, in educating, because we reckon that in this era, the issues surrounding COVID-19 tend to be a bit complex, and that you need to simplify it in the manner that could be assimilated by the group of people that you are communicating to. So, if you lump it all together and communicate in a manner that doesn't sit well with some individuals, they doubt the existence of the virus itself, and that in itself is what is creating problem. I think that the communication strategies could have been a bit broader. Yeah. As in organizations, they are using, most organizations, as I said, are using various strategies, and I think that it is getting well. Indeed, it draws attention to issues of occupational health and safety management in organization. Because if most organizations had this unit and this unit operating very well, then I could have imagined that, well, the occupational health and safety units within the organization, together with their corporate affairs unit, would have put in place maybe proper communication strategy to get these things to sync better. But all in all, I think that in a formal system, we are not doing bad at all.
Yeah, and we know that once schools are returned, Safam, it also means that the larger population of young people go there. But what I have noticed by way of my experiences is that the young people, because they've stayed away for a long time, long for socialization. And when they meet each other, there are no holds barred. They go all out. There's no guidance and caution. Now we are saying they should go back to school. We're easing it slowly, and ultimately everybody will go back to school. But that's where the danger lies for you, the educationists.
For me, if you notice what we are doing currently, it's not all students that are allowed to get back to school. And I was looking at a document, and we can also allow children or students to stay in the house for all this while. Mind you, before the COVID, we were already struggling with a reading and learning deficit around 53% for the ages of 10 in the world. So if we keep the children in the house saying that the COVID, meaning that the interest of the children, they will lose interest in the educational experience altogether. So it was not a decision for us to say that because of the virus, we are going to stay in the house. So gradually, we are easing it and allowing the examinable or examination classes to get back to school. That is why the government is starting with the final year students to get in, finish their exams, and they will look at what will happen when we get back to school. But then with the communication, with the education back and forth, students receiving information on their phones, advertisements, public relation or public education going on, social distancing, the reason why social distancing is important and other things, I am sure it is sinking in. The first day we went back to school, every student that would enter the compound had a mask on. There were vertical buckets at the front of the gate where you wash your hand and then you get into the school. And class sizes have been reduced, so from 30 to 40 or 50 to 20 or 25. And you are telling them these are the reasons. And the guidance and counseling unit has also been tasked to go to every classroom and educate the students on, hey, this is real. You need to protect yourself to protect me, just like our Minister of Education said. And I'm sure from the age 15 to 6, some of them are even 20 years, they really understand what is happening. And it's a challenge, but we need to move. We can't stay in there. That is why you notice that there's more of collaboration where we are, where ideas are being sought from the technical people, the financial people, the health people, the psychologists, and everyone. We are also optimizing the resources, the scanty resources that we have. We are telling ourselves that it is not enough. Already before the virus itself, we are having issues with infrastructure deficit in our schools. We are having issues with content and other things. So the little that we have, how can we optimize it and make the best out of it? Some people are also dedicated. The CRESA bodies, that is educational CRESA bodies, are also assisting the government. The telcos are also helping. Okay, let's ease it, especially with the tertiary institutions. I'm sure they are not paying data for everything they are using. They are enjoying some discount here and there. It could have been better, but whatever they are using now, I'm sure it's helping. We are also engaging in the fourth industry revolution techniques in leadership, where you are saying that the onus does not lie on the leader alone to provide the solutions. We dialogue, we engage, we come with the issues, we get the feedback and get the feedback into the system again. So the decisions to educational content delivery, the assessment, how to even examine the children are all being considered. That is why I said from the beginning that we were not ready for this. The way we design our content was not even suitable to feed it into the ICT system. But now the virus is here. We can't continue staying in the house. We need to go in there. So how do we design the content to feed it into the system where a child with a phone can access the content, where if there is no phone, a radio, a child in the hinterland can listen. It might not be the same as a child in Accra or Kumasi or Takoradi who has got access to tablets and can actually engage the instructor with audiovisuals, watch videos, pictures, and interact or even ask questions. But it is better than nothing. It is better than we sitting at home. It won't be the same, but progress is being made. It is slow, but it's sure. But comparing us with other African countries, they are all collaborating. There are so many documents online. And when you look at the model that we are being used, you notice that other countries are also using the same. I was happy when one of the guests, the professor saying that it wasn't just generic, it was contextualized, context-based, looking at our needs and coming up with the best way possible. So yes, there are challenges out there, but yes, we need to move out there. But that is what I think we should be doing.
Now, that said, as we transition to the last leg of our conversation, let me put this to you, Dr. Paul Boafo. You look at what we have experienced the last 100 days, we're entering the 4th month. Something has got to give. So we're changing our lifestyle. What do we envisage is going to be the lifestyle of the church, of the workplace, of education, of the medical doctor, of the patient who wants to visit the hospital, etc.? What have we got to give to enter the new normal?
Well, thank you. The first point we need to know is that COVID is real. And since COVID is real, it has come with a whole lot of protocols and policies that can mitigate against it. And these ones must not be glossed over. We should also understand that life will not be the same as it used to be. So when it comes to the church, now we have reopened with all the protocols in place, and you see that there are changes. Now it is a cap of 100 people at a service, with all the social distancing and all the protocols of taking the temperature, taking data, so that we can do contact tracing and all that. How do we even go through our service, the liturgy that we used to have? How do we sing? All these things are going to change, and it's part of the new normal. We should not just ignore it because we have not found a cure. We have not found solutions yet to it, but these are protocols that must be observed. So when it comes to the workplace, the protocols must be observed. When it comes to the schools, all these things must also be observed. In every sphere of our lives, wherever and whatever we can do to stop it, to stop the spread, we have to do it. The second aspect is where we talk about stigmatization. We know that people fear to come out if we concentrate and then stigmatize people. They'll be scared. They will not come out. And that will lead to the spread of it. It will be suicidal to have people keep the virus and not come out and then to be cured. So we should also guard against it. Let us own our people who are cured. Let us bring them. Let us embrace them. Let us make sure that they are part. We even have to thank God that they have been healed and then embrace them. And in embracing them, we'll make sure that others can also come out and tell their story so that we all can be healed. My other point is that as a faith-based or religious bodies, we will continue to pray. We will continue to allay the fears of people using the scriptures, because it's God who controls everything. There is nothing that human beings can do without God. And so as religious bodies or faith-based organizations, we will ask that we keep our trust and our hope and our confidence in this God whom we know as a healer. He heals our diseases, and he has made us assure that he is with us. He has not abandoned us. in the midst of COVID, he is still with us. And he will travel with us, he will journey with us, he will go with us, and he will see us through to the end of all of these. And I will say that to all our people in the church and out of the church, wherever we find ourselves, if you are a Christian or a religious person, please be obedient and observe the protocols so that we can protect ourselves and we can heal ourselves from this pandemic. That's what I would want us looking forward to be observing.
Professor Yosin, what is going to change? What should we carry on the clinical side, the public health side, going forward?
The practice of medicine also is going to change hereafter, because we need to improve our infection prevention and control measures, improve the skill of our health personnel, and the soft things, as we always say, the science and the research aspect of our medical care should be improved, human resources, and also as we improve our infrastructure. What we as health workers will continue to put across is that, as the name implies, personal protective equipment are consumable, and these are consumed, and therefore we need adequate supplies of these. It shouldn't be that we've given you this and it's enough. It will be consumed, and we wouldn't want to put our health workers at risk. So that is something we want to put across, that all we need to work with should be provided as much as possible so that health workers will be confident and prevent non-COVID related deaths, so that all the attention and focus because of COVID will make us apprehensive, and because we feel less protected, we wouldn't be able to work at the optimum level required. One thing I also want to say that in going forward, yes, if we leave things to the discretion of people, it is always going to be difficult. We need to encourage and involve traditional authorities, the churches, and all the major stakeholders. Again, at a point, you need to legislate, which we have rightfully done. However, the enforcement of this should be looked at. Therefore, the target of the law enforcement should be those who create the most risk, those who are involved in mass gathering, rather than targeting individuals in their cars, air-conditioned, rolled up glasses. These are less of a risk to the population. Let's target where the issues are as we move forward. And in a concerted effort, the whole nation will stand benefit.
Professor Amponsah, the world of work, what is going to change?
Indeed, the world of work is not going to be the same again, because now, especially so in our country, Ghana, we've come to appreciate the fact that, well, employees can work from home. So yes, we're going to see a lot more of telecommuting, where people are going to work from home. So, well, what is going to happen is that, well, organizations are not going to spend huge resources having to rent huge buildings for their employees to come, travel from long distance to come. Yes, you're going to have a lot more of the employees going to work from home, which has implications for work design, which has implications for the management of such employees. And indeed, it requires new thinking in the way of organizations. So now we have to be thinking about, yes, how to create resilient leaders in organization who will lead to which will lead to the creation of resilient cultures in organization, so that, well, individuals working in organizations now become so resilient and are able to also innovate and come up with new ideas that will get their organizations moving forward. The other thing that we need to be talking about is ethical leadership and ethical culture. You will understand that, well, as people are now going to work from home, they need to be ethical in their conduct. Because at the end of the day, there's an output, there's a productivity that, well, you need to ensure to get your organization going. So while things are not going to be the same again, the employee now is becoming increasingly aware, and the employer is now to be increasingly aware that, well, they need to engage more with employees, which means that, well, now managing employees remotely is differently from when they are on site. Because now what is going to happen is that, well, a lot more freedom, a lot more autonomy, a lot more independence is going to be given to the employee to decide the how, the what, and the whys of his job. This calls for some training for employers, especially when it comes to the leaders in organization, to know how to manage remotely. And finally, to say that, well, organization ought to be creating what we call learning organizations. And in creating learning organization, what it means is that, well, they have to do away with the traditional cultures of not allowing employees to be part of the decision-making process, because we've all come to realize that, well, yes, it is important at this point in time that, well, we bring everybody on board. This will call for employers and their leadership of organization to be emotionally intelligent in their engagement with their employees and in their engagement in their organizations. At the end of the day, yes, the organization stands to, and we should also realize that, well, at the end of the day, well, we do not have a permanent contract with our organization. If it had not been for the COVID, artificial intelligence was going to come. Employees also would have to put themselves in readiness and be ready to acquire new skills and new knowledge in new areas that they can easily translate. So, well, if I will end, I will say that, well, preparing for your retirement and preparing for any eventuality is now.
Wow.
It is only people who are able to prepare for eventualities and their retirement now that are able to adapt without panicking. But you reckon that because most people have not prepared for their retirement and they are not prepared for eventuality, you reckon that, well, with this current situation, most people were caught unawares and they were panicking. I would advise employers to be training their employees on how to prepare for their future, how to put resources aside so that when the eventuality comes, they are able to bounce back and be able to quite resilient. So that is one of the areas that, well, yes, employees should be thinking and employers also should be thinking. Thank you very much, Roland.
Wow. Innovation, preemptiveness, preparation, and then making sure that you reinvent yourself. What do we take forward? What do we know the future is going to be like from now, Sefam?
So from the parental perspective, where most parents were not in tune with whatever happens in school when it comes to their child's educational delivery, it has to change. I'm sure it has even changed now. You've had several discussions with parents and school managers on your very platform where parents were telling you how they were struggling to even set the tablets and set their children up for their online classes. Some of them had no clue about what to do. Some were also struggling with the resources to even buy the phone or the tablets and the data. You realize that it was something that they were not ready for. So, but moving forward as parents, it's not going to be business as usual where you don't care what happens. After all, you pay the school to educate your child. So when they come with assignments or whatever, you are not part of it. You are tired. Now they are home. They are homeschooling. You are there. You come back from work. You need to supervise. You need to make sure that whatever assignments have been given to them, they've submitted. It is done. They've researched on the way. And in terms of educational delivery as well, where most teachers don't even have a clue as to how to prepare their materials or content and load it online, PowerPoint and other things. No, it's not going to be business as usual. We need to migrate from the traditional way where you prepare your content, taking into consideration the different levels of the children, where some are visually stimulated, others are word, others are musically inclined, taking all these levels so that when you're preparing your content, you know that you need to touch every child. It's not going to be one jacket fits all. So that goes for the education. So it's something that it has come, and it is helping us to change the way we go about things in terms of how we deliver it, how we prepare. It's not going to be business as usual. Our social interactions are not going to be business as usual. Our way of thinking is not going to be business as usual. Everything has changed. Like I said from the beginning, coronavirus or COVID-19 is not the first and is not going to be the last virus to shake our foundation of how we relate. So let's move forward. Let's know that we are preparing. Like one of the professors said, if you don't save now, if you don't put something aside, then you'll be found wanting when the time comes. So please, thank you.
Well, thank you, all of you. I've enjoyed the conversation. It's an ongoing conversation, so it never ends. Sometimes I get audiences or the viewers asking me, Charlie, I didn't know more about coronavirus, but it's because we need to keep the information out there. Otherwise, people tend to just forget, and dereliction of duty is always the bane of humanity. Thank you very much. The Most Reverend Dr. Paul Boafo, you are the president of the Christian Council of Ghana, and thank you for helping us do the discussion. And then also Professor Alfred Yorsson, virologist and disease control experts with the University of Ghana Medical School, also helping us. Professor Mponsateria, my own former lecturer, who is head the HR department of the University of Ghana Business School. Thank you for helping us as well. Great educationists and also guidance and counseling expert and consultant, from Lord-Mensah, helping us as well. And the four of you, you've made my morning. I know that there are many things that we can take away, and I'm hoping that all of us will be in tune and will move forward in this direction. Thank you very much for this.